So you have migraines, and you also have neck pain, but is the migraine causing the neck pain, or is the neck pain causing the migraine? Well, the answer is a little bit more complex than either, but it's also sort of both. I'm a migraine specialist doctor of physical therapy, and I'm going to explain it in a way that you can use it and understand it in the next 60 seconds. Let's talk about it. So a good place to start with any conversation about migraines is we have to understand the trigeminal nerve a little bit. That is this nerve. It's the ophthalmic branch here, it's the maxillary branches in this area, and the blue branches here. But it's also responsible for sensation in your eye and controlling your chewing muscles and even some in your ear. So during the migraine process, the trigeminal nerve is releasing a lot of different inflammatory chemicals, primarily CGRP and a couple other ones, but they act on the blood vessels in the coating around your brain. But when it releases these chemicals, it makes the blood vessels enlarge, which makes your blood pressure feel like that throbbing, pounding headache, as well as all these nerves get really extra sensitive, or the volume dial is basically turned up on them. Now here's how we connect it to the neck. CGRP and other inflammatory chemicals are not just being released out here, and it's not just these nerves that are being sensitized. That sensitivity change is also happening here in the brainstem. So the innervation from the trigeminal nerve comes down here into the brainstem and down into the upper part of the spinal cord and interacts with the upper three segments of the neck. So these are the occipital nerves, and these come out of the upper segments of the spine here. These are commonly seen to be a factor in head pain, especially if you're having pain in the backside of the head. But oftentimes this is way too oversimplified in the mainstream narrative that I see about the neck-migraine connection. And it's not all just occipital neuralgia. Really, the upper three segments are associated with all sorts of different nerves and all the different musculature in this area, the joints, and there's a lot of different areas that can have sensation that is providing signals to your brain. So this image helps me to kind of explain why it's sort of neither. And that's the connection from the neck coming into the brainstem area and from the face goes up through the thalamus and is then processed at higher levels in the brain. So it's processed in the brainstem, it's processed in the thalamus, and then it's processed again in a bunch of different brain networks. So this image helps to depict just how complex the pain process is. And this is referred to as the pain matrix, but these are all the different brain areas that have a pretty important role to play in pain perception and producing the experience of pain. Pain is not really in the face or in the neck. It's actually all going on by your brain producing this experience for you. The last part of the puzzle here, during the migraine attack, there is a change in neurological activity, some of that being cortical spreading depression, or sometimes if it's not on the outside of the brain and it's deeper, it's called subcortical